Good morning, everyone. My name is Chien, and I am from the Center for Medical Education, Yonglulin School of Medicine. On behalf of my fellow authors, we would like to give thanks to the conference organizer for the opportunity for us to share with you how we managed to create meaningful learning opportunities during COVID lockdown for our students. At SEMED, we believe in the importance in promoting professionalism and excellence in medical and health professions education through three key areas: faculty development, innovation and scholarship, leadership and expertise. For this experience, we work closely with the undergraduate education division. I believe everyone would know the trendiest word of 2020 is COVID-19. It caught the world by surprise, and none is spared. Medical education is also disrupted. Students were unable to continue with their training, but education should and must still continue. When educators around the world are navigating through the COVID maze, NUS Medicine is fortunate to have Pathfinders, aka our educators leading us. 6 pathway programs were created and SEMED piloted 2 pathways: the STAR pathway and the Medical Innovation and Entrepreneurship pathway. The STAR pathway introduces concepts and principles in health professions education with a focus on scholarship of teaching and learning, while the MIE pathway aims to spark their innovation and entrepreneurship spirit, leading them to find practical solutions to resolve healthcare challenges as future doctors and innovators. As Master Yoda will say, so the student becomes the master. It is better to expose the students to such opportunities early. The pathways adopted a blended learning approach with flipped classroom model and tools such as edX and SEMED Scholar to provide asynchronous delivery of curriculum. Self-learning materials that were curated by content experts were shared with the students before the workshops. All interactive sessions were conducted via Zoom with the use of breakout rooms for group discussions. To understand and address any missing gaps in the content delivered, the facilitators utilized the polling and the chat functions during the sessions. Communications and interactions with the students are via both Entrada, a learning management system, and Microsoft Teams. At the end of the pathways, students in groups created projects to share with their peers via a grand finale. With the guidance from their supervisor, these are 4 projects born from the STAR pathway. One award-winning project was on the qualities of an effective facilitator. Wouldn't you agree that these are interesting ideas indeed? Similarly, the Medical Innovation and Entrepreneurship pathway also developed 4 projects. Musketeer's idea allowed communication to continue for lip readers. You may have seen something similar on the news earlier during the circuit breaker period. At the end of the pathways, students were invited to complete a voluntary survey. Voluntary surveys brings out more meaningful feedback. STAR students now understood the behind the scenes and hope to be exposed to the concepts much earlier. A medical innovation and entrepreneurship student commented that his horizon was broadened beyond what they usually learn, and it created new opportunities for them to venture into. I'm sure you will agree that the possibilities are endless when you're willing to broaden your horizons. I'm sure you all will know that no projects are without its limitations. Due to the short lead time, everybody put together and all became octopus while trying to stay sane. Faculties were also overstretched that they were unable to effectively mentor the students. Another limitation which we encountered for this experience, also due to the insufficient lead time, is that we were unable to develop a rigorous process to fairly evaluate the students' performances in the pathways. We would also like to take this opportunity to share with you our feelings journey. At the start, everyone panicked, but once we implemented a plan, it was relieving. And now, we hope we are more confident to handle future cases with ease. We believe with this sharing of knowledge gained through this experience, it will be beneficial for the greater good, so that education institutions with similar settings are better prepared for future pandemics. This is the key message that we would like to share with you. Just like an adapter, it uses different sockets for different countries, but it continues to serve its sole purpose of charging your devices. Be like an adapter. Adapt to the situation and continue to serve education's purpose. Before we end our presentation, please allow us to give sincere thanks to Dean Prof. Chong Yap Sing, Vice Dean Education Associate Prof. Lau Tang Chin, all our educators, students, and partners, including administrators, and a special thanks to the Dean's Office Education team. Without their commitment, responsibility, and resilience, we can't showcase this work that maintain the continuity of learning environment. This concludes our presentation. We hope this example serves as a good reference for adapting to the crisis situation and the importance of maintaining continuity of learning environment, which would better prepare institutions of similar setting for future pandemics. Thank you for your attention.